I wanted to express my gratitude to both our institution, the Boston University School of Public Health and the Harvard THN School of Public Health. Most importantly, I wanted to first thanks our conference organizing committee. You will see their photos and their name: Elaine Bertolini, Lily Nichols, Hannah Kim, and Ashlyn Quinn. This has been the entire, and you will see by being featured throughout the conference, the CAFÉ team leads the entire CAFÉ team, as I said, the BU and Harvard University, and our entire community of practice. So we have tremendous success as attracting also sponsor. You will see all listed there below, especially, of course, so as we will see with the first keynote session with tremendous support of the National Institute of Health. So I feel that one of my bigger contributions has been to come up with an acronym, and actually this acronym CAFÉ came to me as on a Saturday morning I was working with Greg and Amruta on the proposal on a coffee shop. And I thought, wow, you know, CAFÉ is a way to bring us together. And what CAFÉ is about is C as it stands to convene a global climate change and health community of practice, A as accelerate climate change and health research, F, foster community of practice collaboration, and E as expand the global climate change and health community of practice. I hope you're all joining me with your cup of coffee or tea as we are launching this important conference. We have been overwhelmed and at the same time overwhelmed with joy and delight that we had 1,300 participants to this conference, coming from many sectors, as you can see: academia, government agency, non-government agency, healthcare, international organization, industry foundations, and others. So thank you for your vote of confidence and for being willing to join us. So there's going to be a lot going on in the next 3 days. We have over 50 conference sessions. You will see through the hub, you will learn more about speed networking session every day, panel discussion, poster presentation, round table discussion, and workshop. This is really an enormous opportunity for the entire community to come together. So please check the HOVA platform to basically review and access the conference agenda, join conference session, engage with other attendees one-on-one or in group, check out our exhibitor, and access our community posts, which includes job openings, future workshop, conference, and discussion. So thank you, and it's my great pleasure. I'm going to turn to my dearest friend and colleague, Amruta Nori-Sarma.
Thank you so much, Francesca. That was a wonderful introduction. And it's really my great privilege to be joining you all today as one of the MPIs of CAFÉ to introduce our first keynote panel. We're going to be talking with the NIH to learn more about the Climate Change and Health Initiative at the National Institutes of Health. And we are also going to be doing a panel style discussion with the NIH directors who are joining us this morning. And I'm joined also today by Flannery Black-Ingersoll, who's going to be helping me with the Q&A this morning. Flannery is one of our wonderful PhD students at Boston University School of Public Health, focused on climate change and health as well. So I think that to start things off this morning, we are going to have a brief video which provides us with an overview of the NIH Climate Change and Health Initiative. So I'm going to ask my colleague, Ashlyn Quinn, to start the video.
Sorry, technical difficulties. Let me try that one more time. I apologize. I am sharing, but it will not play for some reason. Let me just try loading it up one more time. If someone on the CAFÉ side could load it up too while I'm doing this, and we'll have a backup. I apologize for the delay.
Good morning, everyone, and thanks for joining for the CAFÉ sponsored by the Research Coordinating Center. So over the past couple of years, the NIH has been focused on developing a research strategy to address the climate change and health. So we recognize right at the outset that this is much bigger than what any single institute or center could tackle on our own. And furthermore, it was abundantly clear that there was considerable expertise, interest, and capabilities across the entire NIH on the topic of climate change and health. Therefore, we decided to take on this challenge as an NIH-wide collaborative effort. At the core of the effort is a working group of over 160 individuals that represent most ICs across the NIH. Most notably, 11 IC directors have stepped to the plate and have committed to serve on an executive committee, which served to provide strategic oversight for the working group and for the Climate Change and Health Initiative. Aubrey Miller and Josh Rosenthal are co-chairing the steering committee, and Gwen Coleman works to coordinate the efforts across the NIH. The membership of the executive committee illustrates the strong support for the Climate Change and Health Initiative across the NIH. We started with an executive committee of 7 members, including directors of NICHD, NINR, NIMH, NIH-LBI, Fogarty International Center, NIMHD, and NIEHS. And more recently, we added the directors of NIA, NIAMS, NCCIH, and NIAID. The Climate Change and Health Initiative is a remarkably collaborative effort, combining a wide range of expertise and integrating climate and health across a diverse research portfolio. So we asked the working group to pull together a strategic framework to address the health effects of climate change. Now, the ultimate plan is complicated. And it's complicated because, as you can see on this slide, there are direct effects ranging from heat-related illness to poor maternal and birth outcomes. And there are indirect effects ranging from chemical releases into the environment, changes in air, water, and food quality and quantity, all the way to economic impacts with more people living in poverty. And the working group recognized that any plan needs to account for the fact that there are underserved populations, exposed workers, persons with disabilities, individuals who are vulnerable by life stage, those with chronic medical conditions, and populations in low and middle income countries who are especially impacted by climate change. So it was after months of hard work that the working group ultimately developed what we are calling the NIH-wide Initiative on Climate Change and Health. The goal is to reduce health threats across the lifespan and build resilience in individuals, communities, and nations around the world, especially those at highest risk. We developed what we are calling the COG diagram, which illustrates the 4 core elements of the initiative involving health effects research, health equity, intervention science, and training and capacity building. The cogs on the periphery of the diagram illustrate the types of research that will be necessary to achieve the goals that we set out as part of the initiative. The plan is posted on our website at nih.gov/climate and health. The NIH's climate and health efforts span across the United States and have both a national and international focus. The Climate Change and Health Initiative has awarded numerous grants across the country to fund vital centers and alliances, as well as exploratory grants to foster collaboration, community engagement, and innovative research. We have also partnered with the National Science Foundation to collaborate on several projects. So let me take you through some of these programs. So first of all, of course, we are funding the CAFÉ. As you are all aware, Drs. Dominici and Nori-Sarma from Boston University School of Public Health and from the Harvard T.H. Chan School of Public Health, they were awarded a $6.7 million 3-year grant for the Climate Change and Health Research Coordinating Center for the RCC CAFÉ. The RCC launched in May of last year, and it had the goal to bolster research on climate change by fostering collaborative research, facilitating sharing of data resources, and offering mentorship and capacity building to emerging and established scholars across the globe. So most notably, the expectation is that the RCC will bring together researchers, community members, and interagency partners across the country to form a climate change and health community of practice research network. And I can add that I am delighted to learn of the large number of new members to our community of practice as evidenced by the high registration for this meeting. So we are also supporting climate change and health research with the NIH-solicited P20 planning grant mechanism. The P20 awards are supporting exploratory climate change and health research centers. And these centers support the development of a transdisciplinary research environment to sustain a program of fundamental and applied research to examine the impacts of climate change on health and to develop action-oriented solutions to protect the health of individuals, communities, and nations from the hazards posed by climate change. The initial round of awards were to Tufts, the University of California, San Diego, University of Arizona, Emory, and Drexel. Community engagement and outreach is critical to the success of climate change and health. To foster community engagement, the Alliance for Community Engagement, or ACH, was created. The ACH's main goal is to coordinate and build community engagement research opportunities to support community-engaged research and promote inclusion. There are currently 4 ACH-funded hubs, which are located at the University of Alaska in Fairbanks, University of Colorado Boulder, University of Southern California, and the Public Health Institute. The awards were made to ensure that there is a focus on a wide range of underrepresented communities and various climate impacts, and to utilize novel approaches in the field of climate change and health to build community-engaged research opportunities. The NIH is also partnering with the National Science Foundation to promote time-critical research for preparedness, response, and recovery of our communities after an acute weather-related event or disaster. The collaboration with the National Hazards Center at the University of Colorado involves the collection of perishable data focused on high-risk groups and time-sensitive situations. The collaboration with the Rapid Facility Program at the University of Washington provides the NIH with access to health-focused sensors, instrumentation, support services for data and processing. So it's quite a challenge to bring together data on health outcomes, environment, and climate in order to address the many important scientific questions that need to be addressed. So therefore, data integration is another key area of focus for the Climate Change and Health Initiative. CORDS is a new project that will create a resource that links climate and environmental health data with health outcomes data so that researchers can identify, analyze, and reduce health effects associated with climate change events and improve patient and population health outcomes. Currently, there is a focus on the health effects of wildfires to demonstrate the capabilities of the data catalog and its resources. On the NIH intramural side, the Climate Change and Health Initiative has created the Intramural Targeted Climate Change and Health Program, or it's abbreviated ITCH. This program is to promote health effects research in the intramural program. So on this slide and on the next slide are the first 11 ITCH grantees who have received funding to stimulate climate change and health research activities across NIH ICs. There are a variety of climate impacts and approaches represented here, but the main idea is that climate change and health research is now being done across the ICs in the intramural program. As ITCH builds research capacity within the intramural programs, the plan is to establish a branch that focuses on the health impacts of climate change. We are building the infrastructure within the NIH intramural research programs to help facilitate this effort. We are currently recruiting for a lab chief to direct this NIH-wide intramural effort. If you are interested in joining us in this capacity, please reach out. So my slides are available. If anyone would like to read through each of these projects, reach out to NIHS Director at nih.gov. Additionally, the NIH is focused on increasing training and capacity building in this climate change and health research program. The Climate Change and Health Scholars Program, originally launched in the fall of 2022, has now selected its second class of scholars, who are individuals with interest and capabilities outside the NIH. The program is designed to bring scholars into the NIH to share knowledge and to help build capacity for conducting climate-related and health research. I realize I went through a lot of information in a short amount of time, so I wanted to point out that we've developed an excellent resource for information at nih.gov/climate and health. And finally, for a quick summary, we know that a changing climate impacts a range of factors that can affect health. The NIH Climate Change and Health Initiative, including CAFÉ, is doing the research that is needed to better understand complex health outcomes, prevention measures, and intervention actions that can save lives around the world. And finally, I just want to thank all of you for your time and your attention, and I hope all the best for the rest of the conference.
Thank you so much, Dr. Woychik, for that fantastic overview of the Climate Change and Health Initiative. We're indeed very fortunate to be joined today by directors from 5 institutes across the NIH. I'd like to start off by asking each of you to provide us with a brief introduction. Maybe I will ask different directors to join us for an introduction, and along with your introductory remarks for yourself and for the institute that you're representing today, I wondered if you could tell us a little bit about why you personally are interested in this intersection of climate change and the impacts that it has on human health. So maybe Dr. Woychik, we'll start off with you if you don't mind.
Happy to do it. So first of all, I apologize for having the video today. So somehow these slides were done. I could have done it in person, although last Friday afternoon it was a possibility that I would.
Are others not hearing Rick well, or is it just me? No, it's all of us.
Okay, hold on. Let me check. Why is this happening? Well, let's see. How about this? Can you hear me now? Okay, is that better? Great. Okay. Well, let me just start off by apologizing. I could have done the video where I could have done the introduction in person. Last Friday afternoon, there was a risk that I would be called to California to testify in a trial. So I just wanted to make sure that we had those introductory comments. Sorry that somehow the slides were not synced with my audio. But nevertheless, it's great to be here this morning. And as you have just heard, I am the director, Rick Woychik. I'm the director of the National Institute of Environmental Health Sciences. So you asked me, why am I personally interested in climate change and health? So in my response, I want to add that my personal interest is broadly shared with my colleagues across NIHS. So as part of our new strategic plan, we are embracing the exposomics framework for studying the environment. And we're doing this because we understand that if you truly want to understand the impact of the environment, you have to go beyond studying one exposure at a time. So exposomics is a framework that allows us to study and to better understand not only the impact of the multitude of physical and chemical exposures, but it also provides us with the means to understand the impact of the social, the ecosystem, and the lifestyle variables associated with the environment. So in other words, it can't be just about studying air pollution or pesticides or mold or PFAS or other synthetic chemicals like typically toxicologists do. But we also need to study the impact of things like psychosocial stress, sleep, diet, drug and alcohol abuse, and other elements in the built environment like population density, urban land use, food deserts, and, for example, green and blue space. So now our interest in climate change and health stems from the fact that almost every element of the exposome is exacerbated by climate change. I mean, as one specific example is climate change is impacting the severity, as we all know well, of wildfires, actually severe rains as they're experiencing in California right now. But it's not just about understanding how wildfire smoke impacts human health, but there is an increase in the incidence of what we're calling urban wildfires, where communities and businesses are burning to the ground and spewing toxic fumes from PFAS and other synthetic materials in wildfire smoke. So there's just a lot that we have to learn in the context of this exposome framework. And NIEHS is really committed to working with the other ICs across the NIH to take advantage of their capabilities and expertise and to address these challenges of climate and health.
Thank you so much, Dr. Woychik. Next, I'll turn over to Dr. Gordon.
Hi, everyone. Thank you. I'm Joshua Gordon. I'm the director of the National Institute of Mental Health. I'm a neuroscientist by training, but also a psychiatrist. And so you asked us to mention our personal connection with climate change and health. And I would say I've witnessed directly the mental health impacts, at least on youth, at least on my own two kids, when I see them concerned, worried, at times despairing, and at other times more hopeful about the future with regard to climate change. Now, as the director of NIMH, though, I recognize that my kids are rather privileged. The impacts of climate change on their lives are likely to be relatively small compared to the impacts of those living in more underserved, under-resourced settings, and those exposed to more natural disasters, wildfires, heat warnings, et cetera, around the globe. The NIMH for over 75 years has been at the forefront of research in understanding the impacts of multiple etiologies on mental health. And we've recognized for a long time the impacts of disasters and other environmental factors on raising risk for mental illness, on acute and chronic effects, but also the recognition that with the right kinds of preparation and with the right kinds of response, you can build resilience in communities and individuals. And so applying that knowledge learned from studies of hurricanes and earthquakes and plane crashes and the like to the effects of climate change, which is going to be on another scale altogether, is going to require additional work, additional research, additional preparation. And so we are proud to join with our colleagues across the NIH in this effort. And of course, anything that we do to build resilience in individuals and communities for mental health will also build resilience for multiple other aspects of health. And so we look forward to this multi-institute effort for that reason as well. I'll turn it back to you. Thanks for the opportunity to introduce myself.
Thank you so much, Dr. Gordon. Next, I'll turn over to Dr. Zenk.
Thank you. Good morning, everyone. I'm Shannon Zenk. I am the director of the National Institute of Nursing Research, or NINR. NINR's mission is to lead nursing research to solve pressing health challenges and inform practice and policy, all with the goals of optimizing health and advancing health equity into the future. So I'm interested in climate and health because there are few challenges more pressing than this issue that impacts the health really of the entire world. Climate change also disproportionately impacts socially and economically disadvantaged populations. As was mentioned, for example, people of low income, certain occupational groups like first responders and farm workers, pregnant people, people with disabilities, and Indigenous people are especially vulnerable to climate change. So I'm sure we'll hear a lot more about this today and really over the next several days, but reducing the health inequities related to climate change is something I am really passionate about. I'd also add that I am motivated for the potential of science to create change, not only in response to climate change, but to correct some of the greatest inequities we see, both domestically and globally. I think if we can generate the needed urgency, build the infrastructure that effectively mitigates the threats of this existential crisis, we can use that knowledge in a variety of other areas. So I'm really pleased to be joined with my colleagues today. Thank you.
Thank you so much, Dr. Zenk. Next, I'll turn over to Dr. Kilmarx.
Thank you. Good morning. I'm Peter Kilmarx. I'm the acting director of the Fogarty International Center and with that also the acting associate director for international research at the NIH. My own background, I'm a medical epidemiologist trained in infectious diseases. I'm interested also in population health. I've been now nearly 9 years at NIH. The previous 20 years, I was with the Centers for Disease Control and Prevention, mostly living and working in Asia and Africa on HIV research and program implementation. And so Fogarty, we are the smallest of the 27 institutes and centers at NIH, but we support the rest of NIH in global research activities, which are very many, very extensive global portfolio. And then with our resources, we focus largely on training and capacity building in lower income countries and in establishing partnerships among researchers, which we see is very important to solving global health problems. My personal interests, I would go back to my time as a Peace Corps volunteer in a very rural and remote part of the Democratic Republic of the Congo. And I saw firsthand the toll of infectious diseases and weather extremes and other health effects that are now being exacerbated by climate change. Climate change, of course, is a massive threat to health, but also from our NIH scientific research perspective, a research imperative and research opportunity. Many lower and middle income countries are already experiencing especially extreme impacts of the changing climate, disproportionately so. And so this is also opportunities to study and learn with researchers globally to learn how to adapt to the changing climate and the effect on health. There's a lot of creative scientists and thinkers around the world, and it benefits all of us to collaborate and work together. This also fits especially well with the Fogarty mission, since, as we've mentioned, climate change really affects all or almost all aspects of health. And so as an NIH-wide issue, this is something that Fogarty particularly wants to support. There's also a huge need for capacity building in the US and around the world, which is a big part of our mission. And again, the importance of partnerships, which Fogarty emphasizes and is really needed to address and solve these problems. This is also, from my perspective, a moral imperative. These lower income countries, especially small island developing states, they really didn't contribute as much to the carbon burden. And so there's a social justice issue in working globally in this area. Also, there is a self-interested issue. This is a national and global security issue. We're already seeing climate refugees around the world, including those coming from the south into the US, from south of the border into the US. So there is also a self-interested reason for Fogarty for the US to support this as a global research effort. Thank you for the opportunity to participate and look forward to the rest of the discussion.
Thank you so much, Dr. Kilmarx. And last, we'll be joined by Dr. Pérez-Stable.
Thank you and welcome. I'm Eliseo Pérez-Stable. I'm the director of the National Institute on Minority Health and Health Disparities. In my own professional career, I'm a general internist, practiced primary care internal medicine until I came to NIH about 8.5 years ago. So NIMHD focuses on populations with health disparities, starting with all racial and ethnic minority groups, people who are disadvantaged socioeconomically, underserved rural residents, sexual and gender minorities, and people with disabilities. Clearly, in these populations, we see that they are more affected, disproportionately affected by climate change. We probably began really thinking about climate change research at our institute with disasters. I think the disaster with oil spills in the Gulf was probably the first trigger, although it was before my time. And after I arrived as director, Hurricane Maria and the double hurricanes that affected Puerto Rico that year really brought that home to a very mostly disadvantaged U.S. territory that is populated almost exclusively by Latinos. And so although natural disasters are episodic bring a lot of attention, a lot of focus, and support and interest at a moment in time or a period of time. You know, climate change is chronic, it's gradual, and it's getting worse. And so it's sort of like managing chronic disease with individuals, right? Where all we mostly do, as we used to say a number of years ago, we try to slow down the slope of decline. Well, in managing climate change and health, we can't afford to do just that. We have to really reverse the slope of decline in order to really have a future for future generations. So I think the challenges are daunting. The bringing us all together, a number of institutes to focus on this has been, I think, an initial major step in this direction. We are working and coordinating as much as we can at NIMHD. We're focused exclusively on human research, all populations, all conditions, all ages, and so in many ways, with our resources, we try to really address the most dramatic effects on people who are more susceptible, who already suffer from health disparities. I'll just finish by saying that whenever we have an external disadvantage like climate change or a disaster or a toxic spill or a new development with contamination, the people who pay the highest price are poor people and people who are disadvantaged to begin with. With chronic disease, disabled, racial and ethnic social disadvantaged communities, and we've seen this time and time and time again. And so I think that this is an effort to try to change that direction as much as possible with the help of science. So thank you.
Wonderful. Thank you so much. And I just wanted to once again give a huge vote of thanks to all of the institutes for your support of this very important work. As you can see, I'm joining you this morning from my classroom. We have my students who are in my class on climate change and health equity who are joining just on the other side of the podium. So I also want to say thank you on behalf of all of the attendees at our conference for all of your efforts in this field, and also especially thank you from the students as well. So we are going to go into the Q&A portion of this keynote. And I just wanted to mention to all of the conference attendees who are joining us, we may have a few minutes towards the end of this session. If you would like to share any of your questions for the directors in the chat, we will be monitoring the chat on the CAFÉ side so that we can bring some of your questions to the directors as well. But just to start off, I have a question that I would like to direct to Dr. Gordon and Dr. Zenk in particular, although of course anyone is welcome to provide your thoughts as well. We know that climate change intersects with a host of different stressors. We tend to think of climate change as a threat multiplier. And a lot of recent work has become more interested in the intersection between climate change and social and structural determinants of health as well. So I wanted to ask how this is relevant to specifically your institutes and the research and work that your institutes are focused on right now.
Sure. Thanks, Amruta, for that question. Shannon, do you want to go first or should I go first? Okay. So as I mentioned before, NIMH has done a lot of work on the impacts of specifically on disasters and other acute events, but in general on environmental factors leading to mental health. And what Eliseo and others have already mentioned, Peter, et cetera, is that when events afflict areas, it's the communities with the least reserve, whether it be financial reserve, housing reserve, access to healthcare, et cetera, that are the greatest affected. And that's absolutely true for mental health. So we do need to think about not just the actuality of the likelihood of a given area, region, or community to be afflicted by climate change, but also then what their resources are, what their resilience and risk factors are before those events occur. And those resources, as I'm sure Shannon will talk to you about, include community-based resources that have nothing to do with health, right? So whether they have community centers that people can go to escape the acute storms, whether they have buildings that are relatively resilient to the effects of those storms, whether they have the means to evacuate and then return, whether there are social structures in place. So that's all part and parcel of these effects. Of course, climate change will also drive migration. And migration is very, very different for people with very different means, right? My own ancestors emigrated to the United States with nothing on ships, but they, when they arrived, had relatives that they could stay with and community social structures in the Jewish community of New York City at the turn of the century that supported them in their homes. That's a very different, very, very different circumstance than many refugee populations in the world today. And all those will affect mental health outcomes. From a research perspective, the more we understand about how to mitigate risk by creation of both health-related and non-health-related social structures and community structures, and really, really importantly, where those structures need to be built, which communities are most likely to be affected by climate change, and how can we be responsive to the needs of those communities before climate change has those effects. These are research questions that really need to be addressed. I'll turn it over to Shannon, see what I'm sure she's going to have a lot to say on this.
Thanks, Josh. I definitely agree with the characterization of climate change as a threat multiplier. We all know that climate change mitigation and adaptation efforts really need to be based on the best available evidence. And at NINR, we really are committed to investing in research that builds resilience of communities, but also of the healthcare and public health systems, assesses vulnerability, and then intervenes to reduce the impact on human health. So for us, that means research that really actively engages with the mechanisms by which climate change affects health and exacerbates health disparities. And for us, social determinants of health are chief among them. If we can recognize how inequities synergistically produce and amplify the effects of social determinants on health, then intervention research can be more effectively targeted and designed. So in our work at NINR, we also want to invest in interventions that are specifically developed for, and really more importantly with, those who are most vulnerable and marginalized. If that doesn't happen, we will see those populations denied access to potential solutions and forced to endure worsening conditions. So there was a 2023 report in the Lancet on health and climate change, and it referred to this as the human risks of an unjust transition. And we really have to commit ourselves to scientific progress that prevents that unjust transition. And that means prioritizing solutions that address social determinants of health as a key element of our climate response. So NINR, like many others, have multiple funding opportunities calling for solutions-oriented research to address our nation's most critical health challenges, and work at the intersection of social determinants of health and climate change is certainly a place for really bold action. By prioritizing social determinants very deliberately in our research at NINR, we're learning more about upstream solutions, and we strongly believe that investments in social determinants of health research will have ripple effects and have multiply really the benefits in all areas related to health, and that includes climate change. So I don't know if anyone else wants to add.
Okay, we'll move on to the next question, which I'm again directing to Dr. Pérez-Stable, but of course we can open it up afterwards. So within the context of your institute's foci, what critical health disparities are there in climate change exposures and/or outcomes?
So thank you. I think similar to what you heard from Josh Gordon and Shannon Zenk, I mean, one of the amazing things about this field is how much it really reveals the inequalities that already exist in our society. And, you know, much like what happened with COVID-19 in March in 2020, the reason why disproportionate mortality, morbidity occurred in certain racial and ethnic groups, particularly African Americans, Latinos, and American Indians, was related to structural issues and structural inequalities. You know, who could stay home and work were people who were professionals and had the option and the mechanism to do that. Who couldn't? The people who were public facing, the frontline workers, yes, the hospitals, we know that, but also the construction, the food service. So it was really protect the upper middle class and the wealthy by staying home and let the rest of you get infected. That was, I know that wasn't the intent, but that was kind of, looking back 4 years ago, what happened. So in disaster research, we see similar kind of approaches. Going back to Hurricane Katrina, what the loss of an entire community was when the dike burst the day after the hurricane went through and flooded. And what was the structural solution was, well, should we even have a community built in such vulnerable territory? And that was, what would it take to rebuild a community in a safe place where the houses, the community itself could survive. And we will see that happen again. It happened in Puerto Rico in 2017. So the disasters are these multipliers where via social determinants of health, with structural inequalities that exist, the groups that are most socially disadvantaged get disproportionately affected. And furthermore, after a disaster, certain element of our society actually come off gaining wealth because they get all this investment in reconstruction. They run the companies that do it, and they're charging and they're collecting from, because they had better insurance. There are a variety of socioeconomic levers, dynamics that are in play that affect health. They get exacerbated by these climate disasters that really shine the light on these disparities. Now, many different communities have different issues. If you're chronically ill, I mean, again, going back to Puerto Rico in 2017, there was no electricity in 80% of the island for not for a day or two or a week, for months. Many areas had limited electricity, so hospitals had to go on generators. So if you were on dialysis, you basically had to be flown out of the island or die within a matter of a week or two. And people who were dependent on this basic technology we kind of take for granted in our high income society. So that's an example. Look what happened recently last year in the island of Maui with the wildfire that ravaged Lahaina, and Rick mentioned the toxicity generated by rapid burning of all these structures, and a destruction of a community, or really setting it back, a historical community with a lot of culture, and that I venture to say many of us have visited. The native people of Alaska are dependent on migration of wildlife and to adhere to their traditional diet and their living, and are likely to be affected by climate change as that gets impacted. And and there is less ice in the northern part of the globe. And this continues. The people who are most vulnerable to these events tend to be the racial and ethnic minority groups, socioeconomically disadvantaged, people with chronic illness, people with disabilities, people who are otherwise marginalized in society will be more likely to be affected in these different events. But these kind of calls attention events, that we can respond to these events. I worry about what are we doing on sort of the chronic basis to decrease? How do we activate interest in the really long-term issue of how do we decrease carbon? How do we manage the exposure to particulate matter? People do get excited about and respond to emergencies, but then the long-term issues, which are gradual and sort of more subtle underneath the surface, people kind of quickly say, okay, well, let's move on to the next thing. It's not bothering me now, so I'm not going to think about it. And I think I don't know the answer to that. I think that's a challenge we all as a community need to address. So thank you.
Thank you so much for the very insightful comments. And I think one of the themes that we're seeing coming in from the chat and from the Q&A is that these questions are definitely on the minds of some of the members of our community as well. So I'll direct the next question and maybe my final question, and then we'll move over to questions from the audience. I'll direct this to Dr. Kilmarx, which is, what do you see as the research challenges around the design of adaptation strategies to try and address the risks of climate change to health, and also to build resilience, particularly within some of the most vulnerable populations?
Yeah, thank you. And actually just want to start with responding to something that Eliseo mentioned about New Orleans and Katrina. And I was the CDC team lead in New Orleans in the fall of 2005 and really saw firsthand the mental health issues that Josh mentioned. We had a mental health team. That was I was an infectious disease guy. That was new to me about how that issue worked. Also, we're seeing this again and again. We had a team doing surveillance looking for outbreaks of respiratory and gastrointestinal diseases, challenges all of the people on tuberculosis or HIV medication, finding them and making sure they could continue their treatments, infant screening, all of these issues that we don't think about as being climate issues, but getting disrupted in these kinds of emergencies. But about adaptation research, I just want to start by saying that the mitigation efforts to reduce the carbon output to stop the climate from warming are critical and are growing, but they're not going to work fast enough to see the health benefits. So we need these climate adaptation efforts based on evidence of effectiveness and feasibility. They have great potential to protect people and our infrastructure from the harmful effects of climate change, but they need to be evidence-based. And currently, less than 5% of the research literature on climate change and health look at adaptation, looking at these strategies to protect health. And only 25% of those relatively small number of studies are in low and middle income countries, despite having the most at-risk populations. So there's a big gap in the current research in looking at adaptations to protect health. Also, only 30% of the adaptation research considers the health sector. Other sectors are health determining, but the implementation and the evaluations fail to capture the health effects. This is in infrastructure, this is in transportation, in energy, in agriculture. So the big challenge is really working across these disciplines and sectors. We have enough challenge just within the health field to collaborate across agencies. And so this calls for an even greater level of collaboration and forming new partnerships. The other challenge is we need to implement and do research at the same time. We know there's billions and even on a global level, trillions of dollars of adaptation that's ongoing. But it's not being evaluated, and sometimes in any case, and in most cases, not looking at the health intervention. So we need to have creative. We don't have a $1 trillion budget for NIH to look at this, so we need to have these partnerships and have sometimes quasi-experimental step wedge, waitlist control, other kinds of ways of evaluating some of these adaptations. For example, green cities and cool roofs, these lower the temperature but haven't been fully evaluated as to what the health impacts are. We assume that works, but we really need to study that, have the evidence base to see who benefits, who is left behind, and potentially who is harmed. Another example with rest, shade, and hydration interventions to mitigate heat-driven occupational injuries in the agricultural field to protect from acute kidney industry. Some of that has been proven to be effective, but we need implementation research and to adapt that to other populations and to help to ensure the equitable implementation. Just a last example around indoor air filtration. This has been shown to reduce indoor air pollution, indoor air contamination, but we need to see how does it perform in wildfire smoke when people are sheltering indoors. And there's only been one study to look at that, and that did not look at the actual health outcomes or the health improvement with that intervention. So we need other investments. Often they're made to protect existing resources and infrastructure, which is not an equitable way of protecting the people that are most at risk. And then lastly, we really need to build capacity in the area of adaptation research in particular, especially in LMICs, where the low and middle income countries, where the impacts are greater and coming earlier. So there's the imperative and also the scientific opportunity to do research in those settings. I just want to give a heads up, a shout out. We have an NIH listening session on training and capacity building tomorrow, February 6th at 10 a.m. through the conference platform. So please join us to talk about the needs in capacity building and training in the US and around the world. Thank you.
Thank you so much. And now we're going to shift over to some of the questions that we've been receiving from our community of practice. So I'll ask Flannery to kick us off with the first question.
Sure, great. So this question comes from Kristen Malecki. Research and public health practice are often separated within the current US funding models. In thinking about preparedness and response, how will research efforts and findings from NIH support the implementation and preparedness and response amongst vulnerable and high-risk populations once research identifies building communities, et cetera? Will there be resources across the federal government to support public health?
So it's, if my colleagues would allow me, I can take a stab at this initially. I'll start off by saying that, take a look at the climate and health on our website. This is not just about doing research, but it's also implementing and impacting communities who are most impacted, the vulnerable and high-risk populations. So remember that we do have the ACH programs that we're funding to actually reach out into these vulnerable populations and to better understand what their needs are. And so once research identifies, will there be resources? So we have the $40 million as part of the Climate Change and Health Initiative that we've been awarded from Congress, but it's not just the $40 million. Part of what you're seeing from the 11 IC directors that are part of the executive committee, as well as IC directors across the NIH, we do have the rest of our budgets who we would fully, and I can speak for NIHS in particular, there are a number of different grants that we are currently supporting in the context of needs to actually get out and to implement on our research findings. So I suspect my colleagues on the executive committee might want to add more details to that, although I see that we are pretty limited at times. There are a lot of questions coming in. So if there are other points of clarification, feel free to chime in.
All right, maybe if not, in the interest of time, I'll move on to the next question. And I think Dr. Kilmarx, this might particularly be directed to you, although of course any of our colleagues from NIH feel free to jump in. The question that came in from Calais Philippe is, what is the process by which you will engage small island developing states like those in the Caribbean? And will you be partnering with organizations such as the Pan American Health Organization, or PAHO, if those plans are in the works?
Yes, thank you. I guess just to start by saying the NIH Climate Change and Health Initiative is very explicitly a global program that's in the coordinating center, in several of the P20s, climate scholars across the board. There's really a global engagement as part of the NIH-wide initiative. And then specifically, there is some work with the Caribbean and other island states. Grenada is one, the Philippines another. They're not small, but they are an island nation. We do interact with, we've had high-level meetings with PAHO, with the World Health Organization, with other funders, the Wellcome Trust, with USAID. So that's very much part of our process. And again, as I mentioned in my introductory remarks, that the small island developing states in particular are vulnerable to the rising sea levels, to hurricanes and other weather emergencies, to drought. So that's very much on our radar. Thank you.
Great, thank you so much. This one is directed to Dr. Shannon Zenk, and it comes from James Hospitales. Nurses are trusted, close to the community, and much more numerous than medical doctors. So how can we mobilize 30+ million nurses of the world to speak out on the climate and health crisis?
Well, thank you, James. I mean, I couldn't agree more that nurses and nursing has such a vital role to play in this crisis. Nurses are everywhere in so many key clinical and community settings where we can play an important role. We offer, I think, a perspective, right, about looking at the whole picture of health and thinking about solutions that work and address the conditions of people's lives and living conditions. So couldn't agree more that nurses have such a vital role to play. In terms of how we get nurses to speak out, I mean, one way we're doing it is we're focusing on this issue at NINR, which isn't an issue that we have traditionally focused on, but it's such an important health issue, and we need to be part of the solutions. For us, part of that is training. We recently appointed a working group of our advisory council to advise us on the role of nursing research and climate change and health. And one of the recommendations they had was a focus on training. And so certainly we'll be focusing on training the nursing science workforce, but I think the more we can do to educate nurses and the role that we can play, and the many ways that climate change touches people's lives, I think the better.
Thank you so much, Dr. Zenk. The next question comes to us from Minkyo Song. And the question is, the majority of the topics that we've been mentioning here today are focused on susceptibility and risk populations and ways to mitigate the impacts of climate change on health, focused in the realm of public health. And this question is curious about the role that basic science plays in climate and health research.
So maybe I could just start off on this, and I'm sure that my colleagues would have much to say about this. You know, basic science research is critically important. In fact, the executive committee approved a set of climate environments so that our intramural research program can begin to understand some of the physiological responses to high temperatures. And actually, in an interaction with the Assistant Secretary for Health, Admiral Levine, last week, the question also came up is for some of the workers who may be on illicit drugs, like fentanyl, and there's the xylazine, which is another chemical that is often contaminating fentanyl preparations. So how do people who are actually on these illicit drugs, how are they responding to increased temperatures, especially for people who don't have the luxury of working in an air-conditioned building? So there are just a lot of unknowns. And so there's a lot of basic science that we have to tackle. So just starting on the whole effects of increased temperatures on human physiology. I don't know. Let me ask my colleagues. Do you want, Josh? Do you want to give an example of some of the specific things, basic science in NIMH?
I think I'll pass on that one. I'll let someone else do it.
Okay. That, or I'm just looking at the clock here. We have quite a number of other messages coming in. So, kind of the bottom line is a great interest. I mean, one of the cogs on that cog diagram is really understanding the fundamental mechanisms of changes in climate as it relates to human physiology.
Let me just say that I'll just add one thing, Rick, to what you said. Of course, the physiology of heat and other exposures is important, but so is the physiology of stress in understanding the responses to climate change, other impacts in addition to the direct effects of heat. And I'll leave it at that.
No, Josh, it's great you bring that up, because one of the interests that we have, and I know we all have, is are there better ways of kind of quantifying and looking at the biological responses to social stress and some of the other social determinants of health.
Yeah, and I would just throw in a complementary response around clinical science. We've talked about mental health and stress and effects on chronic disease, and I think that this is not just or only focused on environmental public health science. It really has to include the full spectrum of research.
Wonderful. Thank you so much. So in the interest of time, I know we're heading to the end of our session today. I just thought I would ask one final question of our colleagues who are joining us from NIH today. We got a question from our community of practice saying, looking ahead, could you elaborate a little more on key challenges that NIH anticipates in addressing the health impacts of climate change? And maybe also from more of my own personal perspective, in addition to the challenges, if you could comment on the things that make you feel hopeful and optimistic about the ways in which we're able to start tackling some of these challenges that we may be facing through the NIH Climate Change and Health Initiative, through resources that are available. Just a note of optimism as we head into the next 3 days of conversations would be wonderful as well. Thank you.
Actually, my colleagues, would you mind if I start off with a comment on the optimism? I just want to start right off, as I indicated in the beginning of my video. I'm optimistic that we can undertake the challenges associated with climate change because, Josh and Shannon and Peter and Eliseo and all of my colleagues on the executive committee at the NIH, as well as other IC directors. I mean, we have joined forces and we're taking on the huge challenges, and it's complicated. So I'm actually very, very optimistic that we're going to make progress because we're working collaboratively together to undertake these challenges. So I'm very excited about this, and I'm very thankful that my colleagues across the NIH have really engaged, and we're developing, these collaborative strategies to undertake this very complex problem. But do any of the other IC directors want to chime in on this?
I would add a challenge and then echo your optimism. I think one of the challenges as we approach climate change and health is to retain the focus on health. And I understand that there is much need in the community for global solutions to climate, right? And to try to reduce the overall impact of climate, to reduce carbon, lots of other things. But our role in this really is on health, and those resources are needed because climate change is happening, and we need to understand how to mitigate those risks and enhance resilience. And so I think maintaining that focus on health is a challenge which we will need to be vigilant about. I want to echo Rick's general optimism, but also add that, a lot of what we're talking about, whether we're talking about the basic science of physiology of heat or of stress, or whether we're talking about community building resilience, the IC directors on the table will tell you this work has been going on. And so we have a basis for applying what we've already done and what we're trying to build even larger across multiple domains of NIH to the climate change and health issue. And so I think we're building on a foundation of research that is expanding, a lot of interest in the community that is expanding. Young people want to go into not just climate change and health, but in general, social and structural determinants of health more and more. So I think the community is expanding as we speak, and that also gives me optimism.
Thank you so much for those remarks. I think we've come to the end of our hour together, so I just want to once again extend my warmest thanks to Dr. Woychik, Dr. Gordon, Dr. Zenk, Dr. Kilmarx, and Dr. Pérez-Stable for joining us this morning. We greatly appreciate the resources and support that the NIH Climate Change and Health Initiative has provided to CAFÉ, and we hope that you are able to join us for all of the participants are able to join us over the course of the next 3 days. Please continue bringing your questions. Please continue bringing your enthusiasm for these topics. And we're so excited to open up the conference. So thank you.
Thank you.
Thank you.
Bye-bye.
Thanks everyone for your participation.
Thank you.
Okay, take care.